Hello and welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202-838-6837 and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get the next show. And now I'm pleased to welcome back our guest, Nicole Jorwic, the Chief Program Officer at Caring Across Generations, to talk about what's going on with Medicaid.
Hi, Laura. So glad to be back.
Well, let's start with Congress is out this week on recess, but we have heard some rumblings about what's happening and what is going on with Medicaid, as you've talked about before. Tell us.
Yeah, so we talked at the end of last year, and sadly, a lot of the things that we talked about probably happening is starting to happen. But I do just want to make sure that folks know that it's a long process. I keep saying it's a Medicaid marathon, not a Medicaid sprint. So what has happened in the last couple of months is that the House and then the Senate and then the House again passed a joint budget resolution that calls for at least $880 billion of cuts. So the first step is the budget resolution. So that part is done, but the bill itself isn't done. The cuts themselves are not done. So it's a really important point because now they have the resolution and now they have to start drafting the reconciliation language, which we'll see in the next couple of weeks. And they're going to have to start showing their work. A lot of members of Congress on the Republican side were saying things like, we're not going to cut Medicaid, or that's not what this language means. Well, now they're going to have to start showing their work. And so that's a really important time for us to be paying attention and for us to fight back against the proposed cuts.
And just to reiterate what you're saying, there's no way for them to find nearly $1 trillion worth of cuts without cutting Medicaid, right?
Absolutely. And that's not just my guess or anybody's guess. The nonpartisan Congressional Budget Office figured out, and we'll again have exact scores once there's actual text, but they said the $880 billion number, there is no way to get that $880 billion number without making at least $500 billion in cuts to Medicaid.
And just to be clear, they could find $1 trillion out of Pentagon waste or other places, but from the committee that they have charged to cut nearly $1 trillion, there is not enough money in that committee from any other place but to take it from Medicaid.
Absolutely. The committee that is being charged with cutting the $880 billion oversees energy and commerce. So that's Medicaid, that's climate, that's a lot of other places, but there's no military spending in that jurisdiction of that committee. The only place that they can really look to are programs like Medicaid and Medicare, and we know from the conversations that they're looking at Medicaid. And that's the instruction. There's nothing that they can do. That was the decision that was made to pay for the tax cuts that they're trying to make for the wealthy. They want to pay for that by taking away healthcare and taking away Medicaid coverage from people.
And let's be clear, this is a choice. Nobody is forcing them to take away healthcare from millions of Americans to pay for tax cuts for the rich. This is their priorities and what they are choosing to do, right?
Yeah, absolutely. There's nothing in this budget reconciliation process that is required. This is a process that the majorities in Congress, the Republican members of Congress, decided to take up, and they are making the choice of where to use public dollars. They're saying we're going to take the public dollars that have already been allocated for Medicaid and instead cut that to pay for the tax cuts. It's not a required process. It's not the budgetary process that we always go through. And it is a choice about where public dollars are being spent. And as of right now, everyone who voted for that joint budget resolution voted for the fact that those public dollars shouldn't be spent on healthcare, shouldn't be spent on long-term care, but should be spent on tax cuts for the wealthy.
And just to be clear, again, nobody is forcing Congress to do this. Congress could give up on the budget reconciliation process and do a bipartisan budget to expand healthcare and make services available for the Americans that need them. But instead, they are choosing the path of cuts, and they are choosing the path of cuts to the people that can least afford to give them up. and all to pay for more yachts for Elon Musk and Jeff Bezos and Mark Zuckerberg and more billionaires. So there don't seem to be doing anything in terms of the overcharging Medicare and the Medicare Advantage waste. They're going squarely at Medicaid. Can you talk about who benefits from Medicaid and who is going to suffer for these tax cuts for the rich?
Yes, there are nearly 80 million people all over this country, everyone of all ages. So there are children in the Children's Health Insurance Program, that's Medicaid. There are coverage for disabled students in school, that's covered by Medicaid. Then there are many other working adults and working age adults that are caregiving or disabled and not working who are receiving healthcare coverage. And also Medicaid is the main funder in town in this country for long-term care. So we're talking about healthcare, we're talking about home care. These are the services that are currently on the chopping block.
And some of these elected officials will say they're not going to hurt people who are deserving, that they're only going to cut waste, fraud, and abuse. That is the favorite talking point. Can you talk a little bit more about how whatever types of cuts they establish, this is going to hurt the people that need Medicaid the most?
Yeah, absolutely. Every dollar that's being spent on Medicaid, every person who's on Medicaid right now needs to be on Medicaid. And so this waste, fraud, and abuse talking point that seems to be making the rounds is a distraction. And so we need to not buy into it, because in actuality, Medicaid is an incredibly lean healthcare program. Compared to private insurance or even Medicare, the administrative costs of Medicaid are incredibly low. And these we need to get people off of the couches and working. Again, a fallacy. 92% of Medicaid beneficiaries are already working. But in this current economic climate, that could change at any point. And if someone loses a job, that Medicaid's not going to be there anymore if these cuts come to pass. And so again, this waste, fraud, and abuse, the waste, fraud, and abuse in our healthcare system is with the big corporations. It's not with Medicaid programs, and it's definitely not with individuals who use it.
Mm-hmm. And I'm especially worried about if they establish these paperwork requirements, how are seniors in nursing homes going to be able to deal with needing to log into some kind of system or spend hours on the phone getting through trees to report their eligibility? They're going to say that various groups of people are exempt. But how are those people actually going to be able to keep their Medicaid? And if somebody has severe disabilities, if somebody is pregnant and they're going through childbirth, all of these extra paperwork hoops are easier when you have good Wi-Fi, good computer, good mobile phone, and you have the time to navigate them. But when somebody is working 2 or 3 low-wage jobs, or when they are a caregiver caring for somebody who needs care, or if they are somebody that needs 24-hour care, how are they going to deal with reporting that they should be eligible? And in fact, the way that they plan to save money by these paperwork requirements is by kicking people off of insurance who should have insurance that just can't jump through the hoops.
Yeah, absolutely. So there's a lot of proposals out there. And again, we're going to see what exactly those proposals are in the coming weeks. But whether it's work reporting requirements or eligibility reporting requirements, it's putting an undue burden on disabled people, family caregivers, low-wage workers to maintain the thing that they need in order to maintain their health. I will talk about my own brother. I have a brother who is 35 and lives in Illinois and has autism. He has autism now. He'll have autism 3 months from now. He'll have autism 6 months from now. Why is it that we're going to put on additional burdens? Again, this to me sounds like waste, fraud, and abuse, asking other people who need these services to go through these processes, often relying on paper mail, because that's how out of date the vast majority of state Medicaid systems are, or even if you have an updated system, relying on disabled people or like my three grandparents that I'm still lucky to have in their 90s to navigate these systems to prove that they still have a need. That does not make any sense. And we also have data that shows that these are not things that actually they cost a lot of taxpayer money to actually set up. In Georgia, they have a work requirement. In the first 18 months, it cost $60 million to create, only covered 6,500 people. Because again, these programs are not created to cover more people. These work requirements and other things are created to kick people off of health coverage. So $60 million to set up a system that ultimately only covered 6,500 people. And you want to hear the waste, fraud, and abuse? 84% of that $60 million was administrative costs, not services for people, administrative costs, taxpayer dollars. I think that all of us can agree, no matter what state you live in, no matter if you vote red or blue, that government funding to provide healthcare should actually be going to healthcare for people, not creating systems to kick people off of healthcare.
Mm-hmm. And also, I think it's important to point out that Medicaid provides healthcare for people who need it. This is not providing yachts to billionaires. If you are using the Medicaid insurance you have, it is because you need healthcare. So any money that is saved by cutting Medicaid is saved by taking away healthcare from people who need it. Not just disenrolling people, because that doesn't really save a whole lot of money. It's taking away healthcare from people who need and are using it. That is how they plan to save nearly $1 trillion, is taking away nearly $1 trillion of health care that is being used by people that need to see their doctors. They need to get services. They need to get their medications. So there's no money to be saved if you just take away insurance cards from people. The money is saved by taking away the health care from people.
Absolutely. You're taking coverage away from people who need it, and those costs are going to show up in different places. Those costs, when people don't see their regular doctor, those costs show up in emergency rooms. So it's really just cost shifting, and that is something that I do think that we're seeing some even Republican legislators in the states start to really hone in on and understand that these cuts, Medicaid is a state and federal partnership. If a state puts $1 in, they know what they're going to get back from the federal government. Some of these things could shift that, and there is no state, red or blue, who can make up that difference. And that's across the board true, but a health affairs article just came out last week that made a point crystal clear with data that I make all the time, which is that there is not a point when there is an economic strife in the country where state budgets have added to human services. So we're coming at a time, everyone's talking about recessions, everything else. We're talking about a time when people might be losing their health care. So more people are going to need Medicaid. And there's not a state that's going to be able to pick up the bag if the federal government cuts it. Even a little bit, even at $100 billion, it's just not going to happen. And that's why we need to be engaging now and making sure that no cuts happen to Medicaid, because no cuts are acceptable to Medicaid. More people need Medicaid, not less.
Thank you, Nicole. And how can people stay up to date on this fight, the attacks on Medicaid, and what Caring Across Generations is doing to fight?
Yes, we definitely encourage everybody to be reaching out to your legislators. There's really easy ways to do that through at Caring Across Gen, GEN, are all of our channels. At www.caringacross.org is our website where you can join our lists. There's great opportunities to share your stories, whether it's in writing or in video. We're going to have a lot of those opportunities, and you'll be able to stay up to date on where we are in the fight. Because as we've talked about, it seems it's a fearful time. A lot of people are nervous, but we still have a lot of steps to stop this. And I just want to remind everybody, in 2017, the last time we faced these massive cuts, the fight went all the way through the summer. So that's likely what we're going to do. So it's important to keep fighting, to not lose hope, but to keep raising our voices and keep talking about the impacts that these Medicaid cuts could have. So follow Caring Across Generations or me and Laura, and you can figure out ways to get engaged at the right moment. And every moment is the right moment for Medicaid right now.
Thank you, Nicole, for joining us. And now we're going to be answering some of your questions and talking about what has happened on healthcare over the past week. So, welcome Louise Norris of healthinsurance.org to tell us about an important Supreme Court case that is happening this week and how it will affect your healthcare.
Absolutely. Thanks for having me, Laura. So this case has actually been on the radar for years. You've probably heard people talking about preventive care benefits under the Affordable Care Act being at risk with a court case. And that case, oral arguments were heard at the Supreme Court this week in that case. And I have a detailed explainer on healthinsurance.org if anybody wants the details, but basically what it boils down to is the Affordable Care Act requires preventive care to be covered by most health insurance plans with no cost to the enrollee, but the Affordable Care Act does not specify what care has to be covered. Instead, they delegate that authority to 3 separate bodies that are tasked with making recommendations of what care has to be covered. And the case that the Supreme Court is hearing has to do with whether or not one of those bodies actually has the authority to make coverage recommendations. So we should have a ruling from the Supreme Court this summer. If they rule against that body having the authority to make coverage recommendations, then some preventive benefits that are currently covered on health insurance plans would not have to be covered going forward. So for the most part, this would be starting in 2026 because most health plans are locked in on their benefits for a calendar year, although that does vary from plan to plan. But this is just something for people to have on their radar that, if you are due for a preventive colonoscopy, for example, this year is a good time to get it scheduled because we just don't know going forward how this is going to shake out as far as what preventive benefits will still have to be covered.
Thank you, Louise, and go to healthinsurance.org to read her more in-depth explanation of the Braidwood court case. And now I am going to talk with Diane Archer from Just Care and Social Security Works about the Trump executive orders on prescription drug costs and what that is, how that's going to affect you. So, Diane, many of our audience are wondering about whether or how President Trump will help with prescription drug costs, since that was one of his campaign promises, and it's a top concern for Americans. So the recent tariffs on China and the recent executive order on drug pricing, there's a whole lot of changes that could be happening to people's prescription drug costs. What's going on?
A great question. As you know, and as you've said, prescription drug costs are such a big issue for so many Americans. And President Trump recognizes that. And yet the tariffs that have been imposed already on China and may be imposed in the next 90 days on other countries could significantly drive up people's prescription drug costs. And that's because both prescription drugs and their ingredients are largely imported from abroad. So already the tariffs on China could be driving up people's prescription drug costs. So now what we have is an executive order as well from President Trump on prescription drug pricing. And he is saying that those executive orders he's just made are going to help people. But if you look deeper into what he's doing, there is serious concern that in fact, they may actually drive up people's drug costs further. It's still early, but what we do know is that the order that was issued on April 15 is going to likely affect Medicare drug price negotiation. Without getting too much into the nitty-gritty details, last year, the Centers for Medicare and Medicaid Services negotiated drug prices for 10 of the most costly Medicare prescription drugs. And they are set to do that for 15 more drugs this year. But the pharmaceutical industry has been heavily lobbying President Trump. And as a result, what his executive order says is that for about half of those 25 drugs, which are pills, that he wants Congress to take another look and possibly extend the length of time that pharmaceutical companies can actually charge whatever they will for those drugs from, it turns out, from 7 years to 11 years. And if Congress does what the president is asking it to do, this it would mean changing the Inflation Reduction Act that was passed during the Biden administration, then many fewer drugs, about, I think, only 12 of the drugs whose prices have been negotiated would actually have negotiated lower prices effective in 2026 and 2027. And with, unless the drug prices are negotiated down, people are going to end up spending more for their drugs in 2026 and 2027 if they're using those drugs. So that's a concern for all of us, because the Inflation Reduction Act was geared towards lowering Medicare expenses, preserving the Medicare Trust Fund, and ideally lowering out-of-pocket costs for people with Medicare.
And what else is in that executive order that could benefit people facing high prescription drug costs?
Okay, good question. I think the most important thing for people to recognize is there is nothing in the executive order that says that the pharmaceutical companies cannot charge whatever they will for their drugs for most people. So that means that the pharmaceutical companies still have a lot of free rein to charge astronomical prices, many times what they charge people in other countries. And as we know, President Trump, as a general proposition, wants fairness between the US and other countries. So we need to be looking closely at this issue and really pushing the president to do what he believes is important, which is to put Americans first and not have us paying more for our drugs than people in other countries. But his executive order does not do that. What it does do that could be good is for people with low incomes and the people who are uninsured. It does call for the community health centers, sometimes called the federally qualified health centers, which are all over the country, to reduce the cost of insulin and injectable epinephrine. So that would be helpful for people going to these community health centers with low incomes to get lower cost insulin and injectable epinephrine. And it also calls for asking the Food and Drug Administration to make it easier for states to import drugs. And that's been an issue. That's something that's been around for a while, but only Florida has permission to do so right now. If other states have permission to do so, yes, states would then be able to get lower cost drugs for state employees and other people, perhaps people with Medicaid for whom the state contributes to the cost of their health care. But that won't help anybody else in the state. What we would need to lower costs for everyone right away is an executive order that allowed people to import drugs from abroad and to pay what people in other countries pay for their drugs. And then actually, honestly, to have their insurers cover the cost of those drugs, which is far less than what the insurers are paying now for drugs. So that would benefit the insurers in the sense that they would be spending less on drugs, and it would certainly benefit all Americans for the moment. And at a bigger scale, at the macro level, of course, what we would want is for President Trump to do what would be most fair, which would be for the government to negotiate the price of all drugs for everyone in this country.
Mm-hmm. And also, I think it's important to point out that to import drugs from another country, there has to be somebody in that country willing to export. So it's my understanding that Florida has been improved for drug importation, but no drugs have actually been imported by Florida because all of that hasn't been worked out. You know, you need somebody to sell even if you're willing and able to buy.
That's very true. I think countries will be absolutely reluctant to give up their drugs to Americans, especially today. I think that Florida has successfully, if I'm not mistaken, I could be wrong, imported drugs from Canada. But again, not too many. And I think your point is well taken that it's very hard for states to get drugs from other countries. What we really need is a law in this country that limits what pharmaceutical companies can charge anyone for their drugs. And right now, especially for the brand name drugs and biologicals, the pharmaceutical companies have pretty much free reign to charge what they will. And that is literally killing lots of Americans who can't afford the high prices. And also driving up the price of insurance, which makes that unaffordable.
And going back to what you said about tariffs a little while ago, it's my understanding that most of the raw materials for drugs are actually imported, and many drugs are manufactured elsewhere as well. This putting tariffs on pharmaceuticals may incentivize companies to build factories and manufacturing plants here, but that is a multi-year process. So in the short term, tariffs do not help bring manufacturing back to America. All they're going to do is raise the prices we pay.
That is an excellent point and absolutely correct. It's not going to bring back manufacturing of drugs to America anytime soon.
Well, thank you for explaining all that. Our next question is from Oh Hey Mom on Threads, who works in healthcare but has horrible health insurance. Yesterday, they went to pick up prescriptions. And they're supposed to use a company-affiliated pharmacy. The cost with insurance for one medicine is $102. Another is $56. The third is $10, and they're all generic. Without insurance, they're actually cheaper. So, Louise, can you explain what's going on, how sometimes using insurance makes your drugs more expensive?
Absolutely. And I know in this case, this person said they described their insurance as horrible, but this is actually not that uncommon. It depends on the plan, it depends on the pharmacy, it depends on the drug. But one of the issues is that in a lot of cases, there are gag orders, but in the contracts that the pharmacies have with the health plans. So depending on the circumstances, the pharmacist might not be able to tell you about this unless you specifically ask them. So they may not be able to come right out and say, hey, by the way, this would be cheaper if you didn't use insurance. So the onus is on you to ask. When you're at the pharmacy, you can ask, hey, would this be cheaper if I just bought it without my insurance? And that may be the case, but it is important to keep in mind if you're going that route, that if you buy a drug from the pharmacy without running it through your health insurance, the amount you're spending is not counting towards your health insurance out of pocket. Basically, the insurance company has no role in that drug purchase. So if you know that you're going to hit your out-of-pocket maximum on your health plan at some point during the year, it might actually be a smarter move to run the drugs through the insurance, pay the higher cost at the pharmacy, because then once you hit your out-of-pocket maximum on your plan, all of your covered expenses, including those drugs, will be fully paid for by the health plan for the rest of the year. Whereas if you're paying cash and not running it through your insurance, you're not accumulating towards any costs. So this is really a case-by-case basis. It depends on your specific needs. You know, if this is a one-off thing where you're just going to the pharmacy and you ask and it turns out the drug is cheaper to pay cash, you know, you might decide to just go ahead and do it. But if you know you're going to have a lot of healthcare expenses during the year, it might make more sense to run it through the insurance so that you can get closer to hitting that out-of-pocket maximum.
Thanks, Louise. And research that people can do at home is they can look at GoodRx or Mark Cuban's website to check drug prices, right?
Absolutely. Yeah, you can. I mean, if you ask your pharmacist, you also need to know that that's the price at that pharmacy. It might not be the exact same price at another pharmacy. So yes, you can do research online before you go, but it is always wise to ask your pharmacist because they might not be able to volunteer that information.
Mm-hmm. Yeah. And that is unfortunate that they may be gagged and they can't tell you that there is a cheaper way of getting your drugs. But it's unfortunate that our system is such that it's really putting the burden on patients to figure it out. And we will be back next week to answer more of your healthcare and health insurance questions. Thanks for joining us. Please text or call in your questions at 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America, and be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.